Have you ever seen a scar that doesn't just, heal and fade? A scar that seems to have a mind of its own, growing bigger, tougher, and way beyond the original injury. Well, today we're diving into one of the most stubborn and misunderstood types of scars out there, the keloid.
It often kicks off with a really common concern. A patient walks into a doctor's office and says something just like this. In Hindi, it's, "Sir, चोट लगने के बाद वहाँ की स्किन बहुत ज़्यादा फूल गई है और अब वहाँ एक सख्त गांठ बन गई है." Which basically translates to, "Sir, after I got hurt, the skin there swelled up a lot and now a hard lump has formed." This one sentence perfectly captures the confusion and worry we're going to clear up today.
All right, so before we can even get into how to fix this thing, we've got to understand what we're actually up against. What in the world is a keloid, and what makes it so different from just a regular everyday scar?
So here's the official breakdown. A keloid is a dense, fibrous overgrowth of scar tissue. But listen, the most important part of that sentence, the real key, is this. It extends beyond the boundaries of the original wound. A normal scar knows its place. A keloid doesn't. This isn't just healing. It's like your body's healing process has gone into overdrive and doesn't know when to stop.
So, how do you spot one? Well, first, there's that overgrowth we just talked about. It just keeps going. Then there's the feel of it. It's not soft like regular skin. It's hard and kind of rubbery. And they're not always quiet either. They can be really itchy or even painful. You'll often see them pop up on places like the chest, shoulders, and, believe it or not, earlobes, especially after a piercing. Now, this is absolutely crucial. A lot of people mix up keloids with something called a hypertrophic scar, and they do look similar, but the difference is all about boundaries. See, a hypertrophic scar, it's raised, for sure, but it's polite. It stays inside the lines of the original cut or wound. A keloid, it breaks right out. And here's the other big tell. A hypertrophic scar might eventually flatten out on its own. A keloid almost never does. It's there for good unless you treat it.
Okay, so this all might sound a little bit complex, but when it comes to figuring out if you have one, how do doctors actually do it? Well, the good news is it's usually pretty straightforward.
Yeah, for the most part, a doctor can tell if you have a keloid just by looking at it and asking you what happened. They'll look at its unique appearance, see if it's growing outside the lines, and listen to the story of the original injury. A biopsy, where they'd have to take a tiny piece of it to study, almost never needed. The scar's appearance and its story tell them everything they need to know.
All right, let's talk treatment. And this is where it can get really confusing because there are so many so-called cures floating around out there, but honestly, a lot of them are just dead ends, ineffective traps that don't even begin to solve the real problem. This is probably one of the first questions on everyone's mind, and it totally makes sense, right? We're all hoping for a quick fix. Is there just a simple pill you can swallow to make a keloid shrink and disappear?
And the short, straight-up answer is no. Oral medications, so pills you take by mouth, are just not effective for this. Sure, something like a vitamin E supplement might be good for your skin's health in general, but it has no power to break down that super dense, overgrown tissue that makes a keloid a keloid. It's just not the right tool for the job.
So if pills are out, then what's in? Let's cut right through all the myths and the confusion and talk about the real deal, the evidence-based, gold standard solution that actually finally works.
The best, most proven way to treat a keloid is to go right to the source of the problem, and that means a direct intralesional injection. Now, intralesional just sounds fancy. All it means is that the medicine is injected directly into the scar tissue itself. So here's exactly how that works. The drug itself is a type of steroid called triamcinolone acetonide. It works by calming down inflammation and telling those overactive cells to stop producing so much collagen. The doctor injects it right into the hard part of the scar until the area turns white. That's called blanching. Now, this isn't a one-and-done kind of thing. The injection has to be repeated every 4 weeks, for about 4 to 6 sessions total, to really break down that tissue. But wait, the injections are really only part one of the solution. To get the best results, you need a 2-part approach. The second part is all about consistent follow-up care, and it's a commitment that lasts for 3 solid months. And this supportive treatment is just as important as the injections. It's simple. You apply a topical silicone gel or a silicone sheet right over the scar. But here's the catch. You have to keep it on there 24 hours a day, every single day, for 3 straight months. Why? Because that constant gentle pressure and hydration is what helps to finally flatten out the surface of the scar. So think about it like a 1-2 punch. It is a perfect tag team. The injection is the heavy hitter. It works from the inside to break down all that dense, bulky tissue. And then the silicone gel comes in and works on the outside, smoothing and flattening the surface. You really need both working together to get that amazing final result.
So there you have it. We went from a simple, worried question from a patient to a highly effective, two-part scientific solution. It just goes to show you how incredibly complex and fascinating our body's healing process can be. It kind of leaves you with one final thought, right? If we can figure out how to tame these incredibly stubborn scars, what's next for the science of skin healing? What other conditions are we on the verge of figuring out?